Welcome back friends, welcome to another video from Shomu's Biology. In this video lecture, we want to talk about chloramphenicol antibiotic, chloramphenicol type of antibiotic and what are the use of chloramphenicol antibiotic mechanism of action, chloramphenicol antibiotic classification, types and examples, and also we'll see the chloramphenicol antibiotic side effects. So let's continue to talk about it. The first things first is the general properties of chloramphenicol antibiotic. And chloramphenicol is an antibiotic and is a class of antimicrobial that inhibits protein synthesis. So basically we classify them as a protein synthesis inhibitors. It's a broad spectrum antibiotic whose spectrum includes several gram positive and gram negative bacteria, and not only gram positive and gram negative. The beauty about chloramphenicol is that it can go up against spirochetes as well as rickettsia. Chloramphenicol is a medication used for the management and treatment of superficial eye infections such as bacterial conjunctivitis, otitis externa and all this. So basically chloramphenicol antibiotic, whenever we see this term, we know in a fraction of a second that we are talking about an antibiotic that can be used in the eye infection, and chloramphenicol is present predominantly in the eye drops, okay, for the conjunctivitis treatment. But as I mentioned, it can go up against spirochetes and rickettsia. What is the mechanism of action of chloramphenicol antibiotics? Chloramphenicol binds reversibly to the 50th subunit of the protein synthesis complex of the bacteria, and it prevents the formation of peptide bond. So basically the formation of peptide bond, that is a transpeptidase reaction, that is prevented because of the binding of the chloramphenicol antibiotic to the 50th subunit of the bacterial ribosome, and that leads to the inhibition of the protein synthesis. So basically if I show you the picture, this is the 50th ribosomal subunit, this is 30th ribosomal subunit, the mRNA is there and the codons are present in the mRNA, and we know the tRNA can interact to the codon with the help of the anticodon, bringing specific amino acid to the place, and in this case we know that there is a transpeptidal reaction and that causes the transfer of the polypeptide chain from the P site, from the tRNA from the P site to the tRNA to the A site, and this transfer is really important, and we know that the chloramphenicol antibiotic is present, and once the chloramphenicol antibiotic is there, chloramphenicol is going to bind to the 50th ribosomal subunit, and we know this peptidal transferase activity is actually catalyzed by 23S rRNA, that is a part of 50th ribosomal subunit of the bacteria. So chloramphenicol inhibits the function of 23S rRNA's peptidal transferase activity. As a result, no peptidal transferase activity is done. So protein elongation or polypeptide elongation is inhibited. That is the mechanism of protein synthesis inhibition. As a result, the bacteria cannot survive. What are the clinical uses of chloramphenicol antibiotics? Limited use is there because of the potential toxicities. That's why we only most of the time use it for the doses for the optical infections, and that is the infection to the eye, okay, eye infections. So a aplastic anemia and a circulatory collapse is also noted in neonates. So typhoid fever is something we can use chloramphenicol against the streptococcus typhi, okay. We can use quinolones. Quinolones are preferred over so even in case of typhoid fever, okay, quinolones are preferred over this chloramphenicals because of the toxicity. Then meningitis is the situation where you can use, okay, particularly ceftriaxone is preferred over chloramphenicol again. So if ceftriaxone is resistant, then we use chloramphenicol, and in case of typhoid fever, if quinolones are resistant, then we move to the resort, and that is chloramphenicol. The third one, again, anaerobic infections. Most of these anaerobic infections like Bacillus fragilis, again in this case metronidazole is the drug of choice, it's preferred drug, but again if it's not working, then you use chloramphenicol. And in rickettsial infection, doxycycline is preferred, but if the doxycycline is unavailable, it's non-responsive, then we move to the chloramphenicol. And lastly, bacterial conjunctivitis. This is the only place where we directly use a chloramphenicol antibiotic as a topical doses. Okay. So topical means the doses on the surface skin. So in this case, in case of conjunctivitis, in the eye drop, we use chloramphenicol antibiotics. So you can see chloramphenicol antibiotics is very limited in terms of their use. In case of typhoid fever, meningitis, anaerobic infections, in GI tract infections, in rickettsial infections, we can use chloramphenicol, but in all these different cases there are different antibiotics of choice that we had. If we don't have those antibiotics and if it's non-responsive, then we move to the chloramphenicol type. Okay, but in bacterial conjunctivitis we use it. What are the side effects of chloramphenicol antibiotic? Bone marrow depression, and the side effects are huge. Side effects are really critical. That's why we don't use it. Second is super infections. Third is irritative effects on the mood, and the fourth was gray baby syndrome. Fifth one, hypersensitivity reactions. These are all different side effects, and particularly bone marrow depression, the irritative behavior, the gray baby syndrome are very common kind of side effects of chloramphenicol. And as chloramphenicol have this really critical side effects over the impact that it may have against a bacterial infection, we don't choose chloramphenicol to use against the bacterial infection quite often, because we have different antibiotics do the same job with lesser side effect. Okay, so that's all about chloramphenicol antibiotic. Okay, and if you like this video, please hit the like button, share this video with your friends, and subscribe to this channel to get more videos like that in future regarding the different antibiotic mechanism of action and much more details. Thank you. Bye.